Peer Leadership Institute webinar series. Today's webinar will be on creating a welcoming environment, resources and information for supervisors. I'm Lisa Smooz, training consultant for the PLI and one of your trainers for the Peer Leadership Institute project. I'm the moderator for today's session. I'm pleased to be joined by the rest of our team, who will now go through and introduce themselves.
Hi, I'm Kristen Dempsey, and I'm Senior Associate at California Institute for Behavioral Health Solutions, and I've been providing a number of trainings for the Peer Leadership Institute.
Hi, I'm Kelly Betts. I'm the program
Yourself?
coordinator.
Kelly?
Hi, can you not hear me?
Hi, I couldn't hear you, I'm sorry.
Oh, sorry. My name's Kelly Betts, and I'm the program coordinator supporting this project.
Great, thank you. And Kimberly Mayer is giving us some oversight. She's the Associate Director over at CIBHS. And as I mentioned in my opening comments, my name is Lisa Smooz, and I'm one of the training consultants here for the PLI project. I'd also like to say a little bit more about my background and why it's relevant for today's webinar. Previous to being the consultant here at the PLI project, I was the executive director of an organization named Peers in Alameda County, which was an organization staffed entirely by people who had lived experience. So overseeing a team of peer staff is one of my passions and specialties. And having been in that supervisor role, I'm bringing that experience to what we'll be learning today. Okay, so the objectives for this webinar. First, we're going to identify some strategies for creating environments that help staff to succeed and stay. As we've talked about in past webinars, retention is an important aspect of working with our peer staff. Supervision strategies for all the staff, not just peer staff. We're going to review the basics of good hiring practices, and we're going to understand how to offer support when you can get some help as well. Kelly, I'm having a little difficulty advancing the slides. I'm wondering if you can take back the mouse and keyboard and just advance the slides when I ask you to.
Sure, no problem.
Thank you. So first, let's talk about how peers can enhance outcomes as part of our behavioral health team. We know that peer support workers are a really promising new addition to our evolving integrated care workforce, and studies suggest that adding peer staff can actually improve patient outcomes and even help reduce overall costs. There's a couple of studies that are up on your screen noting that peers enhance the quality of care by providing a more culturally responsive experience for clients, and the notation about where that was derived is on your screen as well. And peers offer in-depth personal knowledge of community resources, are found to spend more time with clients. They're seen as having a deeper personal understanding of the issues, especially for people with co-occurring challenges, according to this report by SAMHSA. Next slide. However, it's been my experience that although we have the benefits of adding peer staff and they outweigh any potential downside, supervisors and administrators still have a lot of questions about how to hire or bill for the position, or they might have concerns about supervision or making accommodations under the Americans with Disabilities Act. So some of the most common questions, one of the things that I did in my role at Peers was to provide technical support to other agencies that were utilizing peer support workers for maybe the first time. And some of the common questions that I used to get in that position were noted on the screen here. How do you ask about lived experience when hiring? That's a common one. How do you supervise peers? Is it different from the supervision you're giving your clinical staff or your other paraprofessional staff? What if a former client becomes a peer? Dual relationship kind of questions come up around that. How do you bill for services that are delivered by a peer? Do you need to change your policies and procedures in any way when you start integrating peer staff? And a lot of folks have questions about what about the Americans with Disability and accommodations that peers may need. And a big one for lots of folks is how to improve peer staff retention. Turnover rates are quite high in the social services and also especially among peer staff providers. So we're going to get to some of those questions today. Next slide, Kelly. All right, we're going to talk a little bit here about the curb cut principle. So while we're going to talk through these concerns and offer resources, it's important to remember that half of us are going to experience a mental health challenge in our lifetime. And anybody could be struggling with a mental health condition at work, whether or not they're in a peer position or whether or not they share that struggle openly with us. So rather than focus on only one type of position, namely the peer staff position, or the employees that openly talk about their recovery, it's a much better strategy to create an environment that's welcoming and supportive just for everyone universally. So this concept you may have heard of, it's called universal design. Sometimes people call it the curb cut principle. And that's taken from the idea that curb cuts and sidewalks, like the one you can see on your screen, were originally created so that people who used wheelchairs could more easily and safely enter the crosswalks or exit the sidewalk. But the creation of curb cuts, while it was intended for people who use wheelchairs, it ended up benefiting a lot of people who don't use wheelchairs, such as bicyclists, shoppers with carts, parents pushing strollers. So we're going to be talking about what that curb cut principle, what that universal design can look like for behavioral health settings, and how that will benefit all of your staff. Next slide. Okay. So we're going to start looking at what these curb cuts are in behavioral health, meaning while we're highlighting the practices that will create a more welcoming environment for your peer staff as promised, and we'll also address some of those issues of risk management, we're going to be viewing everything through this lens of universal design. So that's going to significantly change our focus from what do we have to do to have encourage risk is that will help all the staff be successful and supported, including this role of peers. So today we're going to be talking about some universal design aspects like creating an environment that supports wellness, offering helpful training and effective supervision, using fair and consistent hiring practices, and also offering support when that's needed. And sometimes that support looks like accommodations, which may be for your peer staff and it may be for your other staff. Next slide. So as we noted in our first webinar, turnover rates among peer staff and other comparable roles can be really quite high. Peer staff often report a sense of isolation and emotional exhaustion as leaving positions. In fact, one study that happened up in Northern California found that out of 151 community mental health providers, so that's peer staff and traditional staff, 54% had high levels of emotional exhaustion. So this obviously poses both financial and human costs for the employer. Financial in terms of hiring, training, billing, all of that turnover gets very expensive. And not to mention the human impact of high turnover and burnout rates on things like client care, as well as individual and team morale. So an investment in an environment that supports wellness is not going to only benefit your peer staff and potentially reduce your turnover and your burnout rates, but it's going to benefit all the employees and create spaces where all the staff can succeed and really want to stay and thrive. So here are some strategies that we recommend for creating this environment that supports wellness. So one option is discussing wellness plans for all your staff as an option. So many of you have probably heard about wellness recovery action planning from the Copeland Center. And it's usually used as a tool for folks with lived experience, sometimes with co-occurring disorders, sometimes with ongoing medical conditions, as a self-management tool so that people can get well, stay well, and really take control of their own care. But wellness plans for all staff, not just peer staff, can be a really great tool in an organization to create this environment of wellness. It's great because it helps on their own wellness, which is something that all of us as mental health providers, whether we're peer providers or traditional providers, can really use a reminder about. Sometimes we get so focused on other people's wellness we forget our own. And it helps us to remember that we all have mental health and we all need to participate in behaviors that approach health. Voluntary selection of an identified supporter at work. Let's talk about this idea. So RAP plan, which is one plan that you can use to have a wellness plan for each individual employee, it's a voluntary thing. It has to be voluntary. If you mandate it, it kind of loses the whole essence of what it is. But making it available and making a training, making a meeting where folks can develop their plans together can be a really wonderful tool. Now, what you would then do is have staff voluntarily select an identified supporter at work. So somebody that they trust, somebody that they want to be their kind of a wellness buddy, if you will, that they're going to check in with, that they're going to share what they would like, what kind of support they would need at work, and that person becomes their identified supporter or companion. Now, these wellness buddy behaviors. So, for an example, a couple of our staff teamed up, and they knew that both of them needed to get light and some exercise in order to stay mentally healthy and well. And so they teamed up with somebody that they selected on the staff that they felt safe and comfortable with, and they would go out and take walks during the lunch break every day whenever it wasn't raining outside. And that kept them accountable, kept them on track, and gave them the support for doing some of those wellness behaviors. So this also is helpful for an employer, because what do you do if you have a staff that's beginning to struggle or has some kind of crisis while they're at work? Well, if you do the wellness plans and you have somebody on staff for each person that's their identified supporter, that person can help per the person's previous instructions about what they would like to have done in cases. It helps to create this. Yes.
Lisa, sorry, you're cutting in and out. Can you just repeat what you said?
Oh, I'm so sorry. So, can you hear me now?
I can hear you now, but it seems like you're cutting in and out a little bit, so we just want to make sure everyone heard what you were saying about the RAP tools.
Sure. So because part of a RAP plan is a crisis plan, or what folks would like to have done in the event that they are struggling or unwell, having that identified supporter at staff that knows the person's wishes can really help to make sure that that crisis period is handled in the way that staff would like and has the optimal outcome in resolution. So the RAP tool is available from the Copeland Center website. You can also get it done via trainings from nonprofit groups that come around and do the RAP trainings. And the Network of Care website that your county has also has an online RAP tool. You can always go to the Copeland Center's website at Winsburg in order to get more information about trainers in your area as well. Another strategy for creating an environment that supports wellness is to make sure that there are career growth opportunities that makes people all feel more satisfied and more invested in their workplace. So some employers avoid this because they fear that staff may, move on and that they'll have difficulty filling positions. But really, happier staff who feel that their organization invests in them also tend to be more invested in their organization and in their work. So really, there's nothing to lose by investing in career advancement. And folks that have been backed and supported by the organization tend to want to advance within the organization. So really, it's training up more staff for more positions. So you might want to consider creating a calendar of free trainings that are available each month, either through your organization, through the county, or through other folks in your area, and posting those perhaps in the break room so that folks can see about trainings that are available to them. Some other opportunities for learning and networking that are really useful if you're not offering some training things yourself or you're having difficulty finding those can be found via the Greater Bay Area Workforce and Education Collaborative. You can go onto the website www.mentalhealthworkforce.org, and there are a number of meetings that have opportunities to learn more, and also training and educational opportunities there. You might consider pairing employees, so they can also do things like consider creating a flexible work schedule or a job sharing policy that allows employees to take classes or complete their degrees. And you can arrange for mentor meetings once a month where senior staff can agree to meet with and mentor one employee within the organization. It can be as simple as something like an hour each month, just checking in with what the person's goals are, how they're doing, offering resources about how to get to that position that they're looking for. And then you can also do things budget allowing, like bringing in a trainer to one staff meeting a quarter, or do something as simple as offering catalogs for community colleges and local university classes in your break room. So it doesn't have to be a huge disruption to your business hours. It doesn't have to be very expensive. There are some simple kinds of ways that you can really encourage career growth and ongoing educational opportunities for your staff and let them feel that investment that you have in their growth. Next slide. So another area that's often noted by peer staff as a source of burnout or job dissatisfaction, and the eventual turnover that comes from that, is a sense of isolation at work and a lack of feeling of community. And at times, especially first adding peer staff to the organization, there can be a sense of us versus them that prevents traditional mental health providers and peer staff from really fully integrating and benefiting from each other's experiences, because they both have really unique skills and experiences bringing to the workforce that's much better when it's a tight team. So changes to the environment can help break down the barriers. Some things to think about. Are there separate staff lounges and restrooms? I know at an organization I worked at a long time ago, when they first integrated peer staff into the environment, they actually had a separate restroom and a separate staff lounge for peer staff and for the traditional staff. And it really set up a not healthy work environment that really prevented people from integrating and becoming a tight functional team. And so eventually they changed that and made it all one lounge and all one set of restrooms, and it really helped bring the team together. So look at some of the physical barriers that may exist in your environment that you hadn't thought through before. You might want to think about, are all your peer staff located in one part of the building? Like maybe there's one workstation area where you have all of the peer staff, and then maybe one area where you have the traditional staff. Maybe look at mixing that and intermingling people together. Do the traditional staff receive preference in office space, access to counseling rooms? It's something to think through as well. You might want to think about, are staff meetings for peer and the traditional staff integrated, or are they separate? Are there any policies that you have that maybe unintentionally create a divide among staff by limiting access to client information or other things? And unnecessarily. Obviously, there are limits to who has access to what information appropriate to their role and the need to know information. But are there unnecessary access limitations or barriers there? The gold standard for breaking down any kind of old attitudes or stigma. Creating opportunities for all the staff to mix and socialize on a regular basis really helps bring your team together, and it erodes these unhelpful barriers. So you might want to consider having staff appreciation meetings off-site where people can eat, talk, and play together, and begin each staff meeting with celebrations of work accomplishments and birthdays from the whole team. And when possible, maybe rearranging workspaces on occasion and lunch schedules to promote this new people meeting and interacting with different staff. There's a word that I love called propinquity, which means that we have this tendency to be drawn to, like, and socialize with the people that are in physical proximity to us. So it's natural and normal for people to, form bonds with their workstation mate on the other side of the barrier there, or the people that happen to be scheduled for lunch at the same time tend to go out together. So consider changing that up a little bit, moving locations of where people are working in the lunch breaks so that they can get an opportunity to meet and mingle and connect with new staff. Next slide. Okay. So one factor that isn't often discussed but can prevent teams of traditional and peer providers from succeeding together at work is stigma. Everybody carries attitudes and beliefs that influence their behaviors, and mental health professionals were no exception to that. For example, actually, in a survey of 1,073 mental health professionals and 1,737 members of the general public, Researchers actually found that psychiatrists held more negative attitudes towards people with mental illness than the general public. And mental health professionals of all types were actually 3 times more likely to support restrictions for people with mental illness than the general public. The author's conclusion was that better knowledge about mental illness stereotyping, and it didn't enhance the willingness to interact with other people that had a mental illness. But we know, fortunately, honesty is the Achilles heel of stigma. So if you can have or foster open and honest discussions about stigma in the workplace, we can begin to lessen your work effects. You guys may have heard of wellness works in the past. That's one example of it. And that can really facilitate this conversation, and it can help create mentally healthier environments for all the staff and promote this more inclusive environment that we all want. Now, with your training today, you got a handout, and on there, in addition, I didn't list Wellness Works because most folks already know about that live training that can come in, but on the handout, there's actually a number of free trainings, and some of them are about breaking down any kind of barriers and stigma that you can access online or share at a staff meeting. So you might consider providing training for all your staff, not just the peers or not just the new hires, that can help everybody feel more comfortable talking about and taking work, really showing that that's a value of your organization. When the trainings are held together, this can really put professional roles, and it can decrease that sense of us versus them that can sometimes creep up and otherwise undermine the morale of your staff. So in addition to trainings that can reduce stigma in the workplace, you might want to consider regularly conducting mini trainings, say, for supervisors and supervisees, just kind of going over, reminding folks about strategies, and providing them some simple tools such as like organizational charts so everyone knows how everyone is connected, directories so everybody knows how to reach everybody. And one tool that we found to be really helpful in the organization I ran in the past was an idea of a decision tree that helps reduce role confusion and promotes better communication. Basically what the decision tree was, there was one for supervisees and one for supervisors about if this happens, call this person, or if this happens, call this person. So sort of a decision tree that folks could walk through for common things that come up in the day-to-day workplace. And it really helped to promote more communication and more integration of the whole team. Next slide, please. So there were a lot of questions about supervision, right? So supervision in what if a peer suddenly was a client and now they've graduated and they've come back as a peer staff employee? How do you manage the dual relationships? Does it differ from traditional supervision in any way? This supervision is, as you might have guessed, it's a subject that really deserves its own in-depth discussion because there is a lot of content there to go over. So the questions that were raised in the beginning of this webinar, such as how to handle that potential dual relationship when the client graduates to peer staff, or how peer staff supervision can differ from traditional supervision, we're going to discuss those in an upcoming webinar just for supervisors. And you see the information there and the when of that. So please make sure to sign up when you're sent the link, or you can contact Kelly, whose information is also on the screen, for more information about how to sign up for that. And we'll spend that whole webinar just talking about supervision. Next slide, please, Kelly. All right, so let's talk about hiring practices a bit. Really, the success of your peer staff completely depends on before they ever walk in the door, before you ever even put the advertisement out. There's a lot of things that you can do to make sure that you get the absolute best applicant for the job, that you create a really level playing field for folks to perform well, and a good match to what it is that you're really looking for. Now, a lot of organizations, and the one that I was running was no exception to this, you get busy and you have job descriptions on file for a long time. And a lot of times we don't really take a look at those, and we tend to use the same ones over and over again without really thinking about what are the things that are really needed. Or there's also sort of a thing that goes on in nonprofit world, some of you guys will probably understand this, to where you have a specific person in mind that you think would be an amazing addition to your team, and you're kind of writing positions to fit a person instead of fitting what the organization actually requires. So I would just really advocate for considering writing new job descriptions about where your organization is now, what are the qualifications that you really need that person to do, and really being as specific as possible about that, so to greatly enhance that the people that you want to apply that fit that description will apply, and that everyone will have clarity about what the role is before the person even begins, and what the expectations will be. A lack of clarity in job descriptions is one of the primary complaints that have been stated by peer staff in the past about difficulty with performing well and succeeding in their job, is not knowing what the job was that was expected of them. So when we do hiring, you also need to understand, what to ask and what not to ask. And this can be, obviously, that's something that's important with every hire, but it can be a little trickier. So when you're hiring for a peer staff position, how do you ask about things like the presence of a mental health condition or lived experience, when traditionally, that isn't something that you ask about in a job interview, and actually there are some laws that prevent you from asking about any kind of medical conditions. We're going to talk about that in just a moment, about what you can ask and what not to ask, and how to get at that lived experience requirement of the job without violating any privacy concerns. Now, obviously, you want to offer a really consistent experience for everyone throughout the hiring process. So you might consider doing things like writing your questions in advance, putting them on a template that are going to be on your hiring panel, and making sure that everybody sticks to the same questions so that each applicant has the same experience. Also, with peer positions and with other positions too, this is sort of a universal design thing. You might think outside of the box about ways that applicants can demonstrate their skills or their aptitude for the position, aside from only the traditional sit down with a panel, answer questions, have a verbal response to a question. Think about the things that you would like to have the person perform on the job. Is there a way that you could do a brief little test where the person could go and actually perform some kind of function and see how they perform in the environment? So try to think outside the box of that, about what's the person actually doing and what kind of qualities are you looking for, and is there a way for them to show, not tell, about those, or show and tell? We always did a traditional verbal interview, but then we had some kind of a practical kind of run through that folks would do as well, depending on what job we were hiring for. And it allowed people that maybe had more difficulty with that pressure verbal kind of side to really demonstrate the amazing skills that they could bring to the organization. Next slide, Kelly. Okay, so for this one, this is what we talked about earlier about what you can and cannot ask legally when you're doing a hire, and how can you get at the information that you still need to do in order to hire the person. So on the left side is the yes. This is the red light, green light thing. These are the questions that you can ask. So you can say, can you perform all of the job functions? Our favorite way of letting a person have the space to talk about their lived experience as a relevant experience for the particular job in a peer staff was just to say simply, so tell me about any relevant experience that you have with the public mental health system. That's an open-ended question that allows the person to disclose wherever their comfort is and whatever they would like to share with that. So some folks would talk about their work history with the mental health, public mental health system, or where they had volunteered in the past. And many folks who were interested in a peer position obviously were very comfortable talking about their lived experience and knew that that was a vital part of the job. And so they would at that point volunteer that they had lived experience and was a part of the public mental health system as a participant, and how that brought the experience that they needed for this job. But this opens it up in a way that isn't asking about any kind of privacy-protected information, and a safe way of giving them the opportunity to talk about whatever they would like to disclose. Can you meet our attendance requirements is fine to ask, and what are your professional certifications and licenses? So the questions that you would want to avoid that are actually not legal to ask would be things like, do you have any disabilities that might affect your ability to do the job? Do you have a family member with mental illness? Actually, folks make that error quite a bit, especially when you're hiring maybe for a parent position. So you can't actually ask, do you have a family member with a mental illness? You can say, tell me about any relevant experience you have with the public mental health system. Again, they can talk about their role as a parent if that's something that they choose to disclose in a job interview. You cannot absolutely ask, have you ever been treated for a mental health condition? You cannot ask about medical conditions. You also similarly can't ask about things like, how many days were you absent from work because of an illness or a mental illness last year? You can't ask about hospitalizations. Again, if you're concerned about things like attendance, you can say, can you meet our attendance requirements? So just remember, this is kind of an overview, but remember, ask about what it is that you're looking for in the job, but remember to always respect the person's privacy and not get to any kinds of medical conditions or anything that are protected by law. Next slide. Okay, so now we're going to have a pop quiz. And this is your chance to speak up, and Kelly's going to put this out here in just a minute. What is the best way to ask if a peer support worker has lived experience with a mental health issue during your interview? Is it A, ask for their diagnosis, B, ask for a note from their doctor to verify their mental health history, or C, ask about their relevant experience with the mental health system? Go ahead and answer your quiz questions now. Okay, Kelly, I'm still not showing results on my screen. Do you not have any results?
Lisa, you should see the results on your screen now.
They are not showing up. Do you have them? Can you just read them off?
Sure. We have 100% of the people choosing C. Ask
Excellent.
about their relevant experience with the mental health system.
That's great. It's a really important question to get, and so I'm thrilled that everybody got that one loud and clear. Awesome. Great job. Okay, Kelly, you can go back to the slides now. Thank you for that.
Oh, what happened?
Are you having difficulty launching?
Yeah. Sharing. You can't see anything.
Technical assistance, technical issues.
Yeah, sorry everyone. We'll be back up in just a moment.
So while Kelly's pulling that up, I will just go ahead and talk to you a little bit about where we're going next. We're going to talk about offering support when needed. And this is one of the most common questions that I got when I was running peers, was about the ADA and accommodations, and folks had concerns. They wanted to support their employees, they wanted to make sure they were complying with the law, but they were a little concerned about the accommodation process. And they had questions like, well, what are accommodations, and what kind of accommodations are used for people with mental health challenges, and where can I get some really common kinds of questions that came up. So in this section that's coming up, we're going to briefly discuss accommodations and how they might apply to folks with mental health challenges in the workplace. And we'll talk about some free areas where you can get support, because as we know in our sector, resources are always tight. And if you're running a small organization, most of the time you don't have an HR department to assist with that. So it's good to know where you can reach out for support. I would like to just reiterate that what we're about to give and what we've been giving is definitely not legal advice, but it's just an overview of how some other people have supported employees and helped them to be successful, and good resources for you to know about where you can get the legal advice that you may need. At the end of the section, I'm going to provide you with a toll-free number where you can actually get more detailed assistance about your specific situation too. How are we doing, Kelly?
Lisa, I'm sorry. It's not, there's just something wrong with my settings, so I'm just trying to make those changes. It'll be just a few minutes, okay?
Okay, no problem. So I'm just going to go ahead and talk through some of the things while Kelly's doing that. So one of the biggest questions that folks often have about this is, how do you know if the ADA applies to your situation, or if a person actually qualifies for it? So just a note that, you know, whether or not you need to provide an accommodation depends on a whole list of factors. One of them being like the size of your organization, the number of employees you have, the type of business, you know, what the employees' limitations or concerns are, what they're requesting, their job description. There's so many different factors. So if in doubt, always, always get assistance from a professional. And there's actually a number of free resources for employers out there. But I will say, one of the things that comes up often, you know, is we're good at networking with each other, and we're good at supporting one another, and reaching out to other fellow executive directors or other people that administer programs. But in this case, you know, asking fellow executive directors or people in parallel positions with you in other organizations about, you know, oh, does this apply? What do you guys do about the ADA and your accommodations there? It may not be the best sort of support in this particular setting, since the type of organization they run, or the business that they have, or the circumstances around the employee situation, it's probably really different from your situation. And you need to remember that discussing the details of an employee's confidential request for accommodations outside the appropriate parties that are involved, like, you know, HR or your attorney, is prohibited by law. So reaching out for support from a fellow executive director or somebody in a similar position as you is really not the way to go. But we're going to give you some resources that you actually can reach out to in this that will be helpful. Some folks actually don't know, you can, many times your insurance provider, so your risk management insurance, sometimes will actually provide free legal counsel about accommodation. So that's something you can check out to see if that's offered. Obviously, if you're with a county organization, you should check in with your legal counsel and human resources department about that. And then there is another place you can go for support as well. Thanks, Kelly. Can you advance 2 slides, please? There we go. So if you don't have an HR department, or your insurance provider does not offer that free legal advice, and you don't have an attorney, the Job Accommodation Network, or JAN, is a great resource. You can call this phone number, which is 1-800-526-7234. They actually have free technical assistance by telephone. They can help you with things like workplace accommodations, the Americans with Disabilities Act and how it applies to you. They can actually go through specifics of that, offering ideas about ways to support employees, and that's free of charge, and that's open to everyone. So a really good resource to take note of and jot down somewhere in your notes, or just print out the slides. All right, Kelly, you can go on to the next slide. All right, so this is probably the most common question that folks ask is, what's a reasonable accommodation? What does that even really mean? Now, just a few reminders really quick. You know, any employee might need accommodation in the workplace. This doesn't just apply to your people in your peer positions or people that have lived experience. Anybody at any time can have some kind of a concern with their senses, with hearing, with seeing, with their ability to move, with or with emotional regulation and mood, or medications that they're taking. It can be a real wide variety of reasons that folks would be covered under the ADA. The basics are that a reasonable accommodation is just a change in how things are done or in the physical environment that allows applicants, so this also applies to people when they're applying for jobs before they're even your staff, or employees with disabilities, to have equal opportunities to everything that the other employees do. it's considered quote-unquote reasonable if the accommodation is something that's customary or feasible for the employer to provide, and that's determined on a case-by-case basis. The employee has to request the accommodation, or the need has to be apparent. For example, the person uses a wheelchair and can't utilize the required workstation because it's at the inappropriate height. That would be something that would be apparent, that the employee wouldn't have to go out and ask you for an accommodation. You should provide that. The employee also can request accommodations in plain English, according to the law. That means they don't have to use diagnostic language. They don't have to tell you what their diagnosis is. They can say things like, I have a medical condition that requires me to take medication that makes this particular shift not possible for me, or something around that. It doesn't have to be a diagnostic kind of a conversation. So the basics of how the accommodation process works is that you get a request in general from staff, unless it's some quote apparent, like the example that we used earlier. You get a request from the staff. Sometimes you'll request documentation about what's called functional limitations, or what are you able to what are the limitations on what you're able to perform, so that you can figure out together via what's called an interactive process, which basically means you have a conversation with this person, a private, confidential conversation, where you talk about what are the functional limitations, what can you do, what do you need assistance with, and then together you figure out what is the accommodation that is most helpful and reasonable in this particular scenario. Then you, of course, implement that accommodation. Of course, all of these are protected by privacy laws. So only the people that are on a need-to-know basis, and normally that's the supervisor from whom received the request, your HR department if you have it, or the person who handles HR within your organization. Generally, those are the only folks that know about what's going on, and all of the records, of course, need to be kept private as well. Now, sometimes in our field, we really want people to succeed, and we're really oriented towards supporting folks. You can actually also err on the side of or assuming that people with lived experience in peer positions absolutely need accommodations because they're in a peer position. So you want to avoid that as well, and remember to just have the lens of universal design and support, like we've been talking about, which is that all employees may need accommodation in the workplace, and unless it's something that is apparent, like that example of the wheelchair with the workspace, you want to just allow the person to reach out and request the accommodations if and when they need them, instead of over-accommodating and assuming that somebody has a disability that prevents them from doing their required job activities. Next slide. So lots of folks have questions about, what kind of accommodations would you use for somebody that had a mental health condition? That's, it seems more obvious when you're talking about a person who's a staff person who uses a wheelchair, or a staff person who is deaf. But what do you do for someone who has a mental health condition? Well, so research studies have been actually done on the most frequently utilized accommodations for people with psychiatric disabilities, and they include things like job coaching, assistance in the hiring process, so a job coach that helps them with the interview or completing applications, job coach support on the job, something in their little scheduling is a pretty common one. So changes in the start or the end of the workday hours, sometimes because of medications or doctor's appointments, things like that. Part-time hours can be an accommodation. Ability to take more frequent breaks. Sick leave for mental health reasons. So sometimes there are limitations around sick leave policies, but being able to utilize sick leave for mental health as well as for what are considered quote-unquote physical conditions. Changes in supervision can be another type of accommodation, so providing maybe extra supervision hours at first if that's what's requested, involving a job coach in the supervision meetings if a person comes with a job coach to work. Modifying the way instructions are given, so sometimes a person might have processing struggles if they're given auditory instructions, but maybe, so one of the accommodations that I've used in the past is to have a verbal one-on-one meeting with a person and allow the person to take notes about what happened during the meeting, and then to also follow up with an email saying, here's a summary of what we talked about today, and just had some bullet points summarizing those, so that there was the notes, there was the auditory conversation, and then there was also the follow-up email that sort of synthesized our mutual understanding about what we talked about, which was really, really helpful with lots of folks, not just folks with mental health challenges. You can do changes in training too, like allowing extra time to learn job tasks or assistance with the orientation process. And then you can also do things like modify job duties, like exchanging or deleting some minor job duties that maybe aren't really necessary to be done by this particular person, and allow them to focus on the things that you're hiring them for. Okay, let's go ahead and go on to the next slide. All right, so we're going to have another quiz. So which of the following is not a recommended source of information and support about ADA accommodations? Is it A, the EEOC, which stands for the Equal Employment Opportunity Council, or B, your HR department, C, the Job Accommodation Network, or D, other executive directors you may know? Which of the following is not a recommended source of information and support about accommodations? Okay, Kelly, you want to go ahead and read off the response rate too, because it's not displaying.
Oh, okay. So everybody picked D, other executive directors you know.
Awesome.
So 100%.
Great. So glad that message came through loud and clear. You know, peer support amongst folks running organizations is a great thing. In this case, it's probably not your best bet. So you want to go to some of those other sources. And the EEOC, which I actually forgot to mention in my previous, great source of support and information. That's actually the legal agency that's in charge of equal employment opportunity claims. And you can go to their website and get some information, and there's also a phone number, and you can reach those folks. So let's talk about resources for more support. So you want to definitely take a look at the handout that was distributed with this webinar, because we have lots of online resources that are listed there. There's actually free online trainings that you can show your staff at a staff meeting, or people can complete individually, or you can take a look at. There's also actually downloadable toolkits that are in a PDF form that you can just download and print out, that goes through all different kinds of things that you may need if you're just now integrating peer staff into your environment, or things that you might want to take a look at and see if the way you're doing it is up to date. Things like templates for job announcements, which is really helpful, suggested questions that can be asked on job interviews, and a variety of things about accommodations that have worked for other folks in the workplace. So go take a look at all of those really good online resources and toolkits that are available to you. There's also some other organizations out there that you may or may not have touched base with in the past that have additional resources about how to really effectively integrate peers. So definitely go check out CASRA, which is the California Association for Social Rehab Agencies. They actually have a toolkit that's out that can be helpful for peer staff. The National Coalition for Mental Health Recovery is another great source. The National Empowerment Center, Project Peer Return Support Network has a variety of tools. And of course, as we probably have all used, the SAMHSA HRSA Center for Integrated Health Solutions is another great resource. So do go and check those out. So now at this time we're going to transition, and we're going to open up this webinar for questions from the audience. So some things that maybe I went over too quickly, or you have a particular question about your setting. So we're going to entertain questions now. So go ahead and just type into the question box what your questions are. And while you're doing that, while you're typing in your questions, I wanted to just make you aware about our next installment in our webinar series. Now, this webinar is for your peer staff. The one that we spoke about earlier, which is the supervision one, that one is actually for supervisors. And I highly recommend that you tell other supervisors that you may have talked with in the past that have questions about supervision to go to that. But our next one for your peer staff that you might want to encourage them to attend is this on transitioning from advocate to employee. That's January 21st, wow, 2016 already, noon to 1:30. And to get more information about that, you want to contact Kelly at kbitz@cibhs.org. That'll be a great one about, making that shift to an employee from maybe more of an advocacy role that they've been in the past. So I'm going to check back in at this time with Kelly and see if we have any questions from the audience that we should talk about.
Lisa, no questions have come through as of yet.
Okay, we're going to give it just another minute here. So if you haven't had a chance to ask the question that is burning in your mind, now is the time to do it. Go ahead and enter that in. We're just going to pause for just a minute and allow folks to type things in if they have any questions. Did we get anything?
No questions, Lisa.
Well, we must have just answered them all. Sorry?
Oh, I just said we have a quiet group today.
We do have a quiet group today. Maybe we answered them all. That would be good, right? So I do really encourage you guys to attend the next one for supervision that's coming up. And Kelly, you can go ahead and move on to the next slide. Of course, if any questions pop up in your mind after the webinar closes out today that you're like, oh, I forgot about that, I would really like to know about that, feel free to pass those on your screen. You'll see my email, which is lisa.smooze@gmail.com. And then, of course, to Kelly, if you have more of the questions about upcoming webinars and how to register, those types of things, you can always reach out to Kelly at kbitz@cibhs.org, and her phone number is listed there as well. So don't worry if you've had the question, you didn't get a chance to ask it, not a problem. I'm always available here by email, and Kelly as well. We're happy to help out. So I would like to thank all of you guys for coming today and participating in the webinar. We are at the end of the time. Once again, we encourage you to take a few moments to share your feedback with us as you exit the session. And with that, we're going to go ahead and conclude our broadcast. Thanks again for joining us.